Diabetes mellitus is considered a chronic disease due to its persistent nature and the long-term impact it has on the body's ability to regulate blood sugar, or glucose, levels. It arises from complex interactions among genetic, environmental, and lifestyle factors, which ultimately impair the body's production or utilization of insulin, a hormone essential for converting glucose into energy. There are different types of diabetes, including type 1, type 2, and gestational diabetes, each with distinct causes and treatment requirements, but all types share the characteristic of being long-lasting and requiring ongoing management. At the core of diabetes lies insulin, a hormone produced by the pancreas that regulates glucose levels in the bloodstream. When we eat, carbohydrates are broken down into glucose, which is then absorbed into the bloodstream. Insulin enables glucose to enter cells, where it is used as fuel. In diabetes, however, this process is disrupted. Type 1 diabetes is an autoimmune condition in which the body's immune system mistakenly attacks insulin-producing cells in the pancreas. With the loss of these cells, the body can no longer produce insulin, making it necessary for individuals to rely on insulin injections or pumps to maintain normal blood glucose levels. Type 2 diabetes, the more common form, often develops due to insulin resistance, where the body's cells become less responsive to insulin. As insulin sensitivity decreases, the pancreas initially compensates by producing more insulin, but over time, it becomes unable to keep up with the demand, leading to elevated blood sugar levels. This form is closely associated with lifestyle factors such as diet, physical inactivity, and obesity, although genetics also play a significant role. Gestational diabetes occurs during pregnancy, often due to hormonal changes and increased insulin resistance. While it typically resolves after childbirth, it can raise the risk of type 2 diabetes later in life. Once diagnosed, diabetes is considered chronic because there is currently no cure, and it requires lifelong management. Unlike acute diseases, which may resolve after a treatment or go away on their own, diabetes necessitates ongoing monitoring and management of blood glucose levels. Without proper control, diabetes can lead to serious complications affecting nearly every organ system in the body, reinforcing its long-term, chronic nature. The high blood glucose levels associated with diabetes can lead to significant damage to various organs and systems over time. Cardiovascular disease. Diabetes significantly increases the risk of cardiovascular issues, including heart attack and stroke, as high blood sugar damages blood vessels and promotes plaque buildup. Kidney damage, nephropathy. Over time, high blood glucose can harm the kidney's delicate filtering system, potentially leading to chronic kidney disease or kidney failure. Nerve damage, neuropathy. High glucose levels can damage the nervous system, particularly in the extremities. This can lead to symptoms such as tingling, pain, and numbness in the hands and feet, and in severe cases, it may lead to amputation. Eye damage, retinopathy. Diabetes is one of the leading causes of blindness, as it can damage the blood vessels in the retina, leading to vision loss or even blindness if not managed properly. Increased risk of infections. Diabetes affects the immune system, making individuals more susceptible to infections, particularly in the skin, gums, and urinary tract. Other complications. Other issues may include hearing impairment, sleep apnea, and an increased risk of dementia. All of these complications further illustrate diabetes as a chronic condition with pervasive, ongoing health impacts. While diabetes is a chronic condition, lifestyle changes can significantly improve blood glucose management and reduce the risk of complications, especially in type 2 diabetes. Regular physical activity, a balanced diet, and weight management can enhance the body's insulin sensitivity, potentially reducing the need for medication. However, these adjustments do not eliminate the condition. Instead, they help manage symptoms and improve quality of life. For those with diabetes, managing the condition is a daily commitment. Individuals with type 1 diabetes rely on insulin therapy, administered through injections or pumps, while type 2 diabetes can involve oral medications, insulin, or other treatments depending on the severity. Regular blood glucose monitoring, often multiple times a day, is essential to prevent spikes or drops in blood sugar levels. Even with effective management, diabetes can remain a dynamic condition, with insulin sensitivity and blood sugar levels fluctuating due to stress, illness, hormonal changes, and other factors. Consequently, people with diabetes must continually adjust their treatment plans with their healthcare providers, underscoring the chronic nature of the disease. Researchers are actively exploring ways to improve diabetes treatment and potentially find a cure. Advances in technology, such as continuous glucose monitors, CGMs, and artificial pancreas systems, have improved quality of life for many people with diabetes by offering more precise blood sugar management. Additionally, ongoing research into beta cell transplants and gene therapies holds promise, but these treatments are still in the experimental stages. Managing diabetes as a chronic condition goes beyond just physical health. It impacts mental and emotional well-being as well. The daily routine of monitoring blood sugar, making dietary choices, and taking medication or insulin can lead to diabetes burnout, a phenomenon where people feel overwhelmed by the constant management demands. Emotional support, therapy, and diabetes education are invaluable resources for helping individuals cope with these challenges. Many healthcare providers incorporate psychological support into diabetes care, recognizing that stress and mental health play crucial roles in managing blood glucose levels. Education is a cornerstone of effective diabetes management. Understanding the disease, recognizing symptoms of blood sugar fluctuations, and knowing how to handle them are essential skills for anyone living with diabetes. Healthcare providers, diabetes educators, nutritionists, and endocrinologists work as part of a support team to empower individuals with the knowledge they need to make informed decisions. Support systems, including family, friends, and support groups, can also make a significant difference. Those with a strong support network often feel more equipped to manage the day-to-day aspects of diabetes, as they have people to share the journey with, offer encouragement, and provide practical help when needed. Advances in technology. Improving quality of life for people with diabetes. Technological advances have revolutionized diabetes management in recent years. Continuous glucose monitors, CGMs, insulin pumps, and smart insulin pens offer greater accuracy and convenience, helping to prevent high or low blood sugar levels. CGMs, for instance, provide real-time data on glucose levels, alerting individuals to fluctuations before they reach dangerous levels. This technology enables more proactive and responsive diabetes management, reducing the risk of complications and improving overall quality of life. Furthermore, research into artificial pancreas systems, devices that automatically monitor glucose levels and deliver insulin when needed, is making significant strides. These systems aim to simulate the function of a healthy pancreas, greatly reducing the burden of diabetes management and providing a glimpse into what a future with automated diabetes care might look like. Diabetes not only affects individuals but also has a broader impact on healthcare systems and society. Managing diabetes is costly, with expenses covering medications, devices, regular checkups, and potential hospitalizations. In countries with limited access to healthcare, these costs can create significant barriers for individuals, sometimes leading to inadequate treatment and a higher risk of complications. This highlights the need for accessible healthcare options and policies that support people with diabetes. The societal impact also extends to lost productivity, as diabetes-related complications can affect work attendance and performance. In severe cases, diabetes complications can lead to disability, impacting families and communities. Consequently, public health initiatives focused on diabetes prevention and management are critical to alleviating this societal burden. The pursuit of a cure for diabetes is an active area of research, particularly in the fields of regenerative medicine and immunology. In type 1 diabetes, for instance, scientists are investigating ways to protect or regenerate insulin-producing beta cells in the pancreas. Stem cell research holds potential, as it may one day be possible to generate new beta cells capable of restoring the body's insulin production. Gene therapy is another avenue being explored to address both type 1 and type 2 diabetes, with the goal of modifying or correcting genetic factors that contribute to insulin resistance or autoimmune responses. Meanwhile, preventive measures, particularly in type 2 diabetes, focus on lifestyle interventions and public health education. Research has shown that weight loss, a balanced diet, and regular exercise can reduce the risk of developing type 2 diabetes by improving insulin sensitivity and blood glucose control. Many countries are adopting public health campaigns that encourage healthy lifestyle choices, hoping to reduce the incidence of type 2 diabetes. Diabetes is a chronic, progressive medical condition that impacts the way the body processes blood glucose, commonly known as blood sugar. Glucose is a vital energy source for cells and organs, particularly for the brain and muscles during physical activity. However, when glucose levels in the bloodstream are inadequately regulated, as seen in diabetes, it can lead to short and long-term complications. There are multiple types of diabetes, with type 1 and type 2 diabetes being the most common. Each type has distinct causes, treatments, and long-term effects on individuals. Understanding these differences is crucial in tailoring effective prevention, treatment, and management strategies. Type 1 diabetes, often diagnosed in childhood or early adulthood, is an autoimmune disorder where the body's immune system attacks and destroys insulin-producing beta cells in the pancreas. This results in an inability to produce insulin, a hormone essential for transporting glucose from the blood into the cells. The absence of insulin requires individuals with type 1 diabetes to depend on external insulin administration through injections or insulin pumps. Without this intervention, blood glucose levels rise to dangerous levels, leading to potential complications such as ketoacidosis, a life-threatening condition where the body produces high levels of blood acids, ketones, due to fat breakdown. Type 2 diabetes is primarily a condition of insulin resistance. In this form of diabetes, the body produces insulin, but cells in muscle, fat, and the liver become resistant to it. The pancreas compensates by producing more insulin, but over time, it cannot maintain this increased production, leading to elevated blood glucose levels. Type 2 diabetes is frequently associated with lifestyle factors, such as diet and physical inactivity, although genetics also play a significant role. Unlike type 1 diabetes, which typically requires insulin, type 2 diabetes can often be managed through lifestyle modifications, oral medications, and, in advanced cases, insulin therapy. Diabetes develops due to a combination of genetic, lifestyle, and environmental factors. Understanding these predispositions can help identify those at high risk, aiding in early intervention and, in some cases, prevention. Genetic factors. Research suggests that genetic factors significantly contribute to diabetes risk. For type 1 diabetes, specific human leukocyte antigen, HLA, genotypes increase susceptibility, likely because these genes regulate the immune system's recognition of the body's tissues. Type 2 diabetes has multiple genetic components that predispose individuals to insulin resistance or pancreatic dysfunction. Families with a history of diabetes have higher incidences of type 2 diabetes, highlighting a clear hereditary pattern. Lifestyle and environmental factors. Diet, physical activity, and other lifestyle factors greatly impact type 2 diabetes risk. A diet high in processed foods, sugars, and saturated fats may lead to weight gain, insulin resistance, and type 2 diabetes. Physical inactivity exacerbates insulin resistance, as muscle cells become less responsive to insulin when not frequently utilized. Furthermore, environmental stressors, such as chronic exposure to pollutants, can affect cellular function and may contribute to metabolic disorders, including diabetes. Obesity and physical inactivity. There is a strong association between obesity and type 2 diabetes. Adipose tissue, especially when accumulated in the abdominal area, releases substances that increase insulin resistance, making weight management a critical component in diabetes prevention. Physical inactivity similarly contributes to insulin resistance and weight gain, making exercise essential for maintaining a healthy weight and enhancing insulin sensitivity. Diet is a foundational element in diabetes management, with recommendations varying depending on diabetes type, individual metabolism, and treatment plans. However, certain general guidelines can aid in maintaining stable blood sugar levels, improving overall health, and minimizing complications. Foods to eat: complex carbohydrates. Whole grains like oats, quinoa, brown rice, and barley are complex carbohydrates that release glucose slowly into the bloodstream, preventing blood sugar spikes. Including fiber-rich foods improves satiety and aids in blood sugar control. Lean proteins. Proteins, such as lean poultry, fish, eggs, and plant-based sources like tofu, beans, and lentils, are beneficial as they have a minimal impact on blood glucose levels. Protein-rich foods can also help reduce hunger and prevent overeating. Healthy fats. Unsaturated fats, found in sources like olive oil, avocados, and nuts, are beneficial for cardiovascular health and can help stabilize blood sugar levels. Omega-3 fatty acids, found in fatty fish such as salmon, are anti-inflammatory and may reduce the risk of cardiovascular complications associated with diabetes. Non-starchy vegetables. Vegetables such as spinach, kale, broccoli, and bell peppers provide essential vitamins, minerals, and fiber without significantly impacting blood glucose levels. They can be included generously in meals to enhance nutritional content without adding excess calories. Low glycemic fruits. Fruits such as berries, apples, and pears have lower glycemic indices and are less likely to cause rapid spikes in blood glucose. They also provide essential antioxidants and fiber, supporting overall health. Foods to limit or avoid sugary foods and drinks. High sugar foods and beverages, including soda, candy, and certain desserts, cause rapid spikes in blood sugar and should be limited. For those with diabetes, it's crucial to monitor sugar intake and opt for alternatives that have minimal impact on blood sugar. Refined carbohydrates. Foods like white bread, pastries, and refined cereals have high glycemic indices, leading to sharp increases in blood glucose. Replacing these with whole grain alternatives helps manage blood sugar levels more effectively. Trans fats and saturated fats. Fried foods, baked goods, and processed snacks often contain unhealthy fats that increase the risk of cardiovascular disease, a common complication for those with diabetes. Opting for healthier fat sources can mitigate this risk. High sodium foods. Processed foods high in sodium, like canned soups and processed meats, can increase blood pressure, which is a risk factor for cardiovascular disease in diabetic patients. Fresh, minimally processed foods are preferable for managing blood pressure and overall health. Alcohol. Alcohol can affect blood sugar levels and interact with diabetes medications, potentially leading to hypoglycemia or hyperglycemia. If consumed, it should be done in moderation and alongside food to mitigate these effects. Diagnosis and continuous monitoring are critical in diabetes management, as they allow for appropriate treatment adjustments and help prevent complications. Blood glucose monitoring. Regular blood glucose testing helps individuals with diabetes understand how their blood sugar levels respond to food, exercise, stress, and medication. For people with type 1 diabetes, blood sugar monitoring is frequent and may involve a continuous glucose monitor, CGM, that provides real-time blood glucose readings. Hemoglobin A1C test. The A1C test measures average blood glucose levels over the past 2 to 3 months, offering a long-term view of blood glucose management. For non-diabetic individuals, a normal A1C level is below 5.7%, while levels of 6.5% or higher indicate diabetes. Fasting blood glucose test. This test measures blood glucose after an overnight fast and is a common diagnostic tool for diabetes. Levels between 100 mg per deciliter and 125 mg per deciliter indicate prediabetes, while levels of 126 mg per deciliter or higher suggest diabetes. Oral glucose tolerance test, OGTT. The OGTT measures blood glucose response after consuming a glucose-rich beverage. It helps diagnose gestational diabetes and can indicate diabetes in cases where fasting glucose levels are inconclusive. Other evaluative tools. Additional tests, such as lipid profiles, blood pressure monitoring, and kidney function tests, are essential for managing diabetes-related complications. Individuals with diabetes are at higher risk for cardiovascular disease, kidney disease, and neuropathy, so these tests provide insight into overall health. Delving further into the science of diabetes, we understand that insulin plays a central role in regulating blood glucose levels. When food is consumed, it is broken down into glucose, which enters the bloodstream, raising blood sugar levels. In a non-diabetic person, this rise triggers the pancreas to release insulin. Insulin acts as a key, enabling glucose to enter cells where it can be used as energy. However, in diabetes, this process is disrupted. In type 1 diabetes, the pancreas fails to produce sufficient insulin due to the autoimmune destruction of beta cells. This leaves glucose stranded in the bloodstream without a means of entering the cells, which results in hyperglycemia, or high blood sugar. The body then, sensing an energy deficit, starts breaking down fats and proteins as alternative fuel sources, a process that, when prolonged, leads to significant weight loss and muscle wasting. Additionally, in the absence of glucose, the liver continues to produce more glucose, further elevating blood sugar levels. With type 1 diabetes, insulin administration is essential. Individuals need to mimic the natural insulin release of a functioning pancreas, requiring both basal, long-acting, and bolus, short-acting, insulin doses to handle glucose levels throughout the day and in response to meals. Technological advances, such as continuous glucose monitors, CGMs, and insulin pumps, have made insulin administration more precise, significantly enhancing the quality of life for those with type 1 diabetes. In type 2 diabetes, the pancreas initially produces insulin, but the body's cells become resistant to it. In response, the pancreas produces even more insulin, striving to compensate, until it eventually becomes overworked and fails to meet the body's needs. Unlike type 1, type 2 diabetes is progressive, often starting with insulin resistance and evolving into partial pancreatic burnout over time. Lifestyle factors like obesity, particularly excess abdominal fat, and inactivity play a large role in developing insulin resistance. The cells in overweight individuals are more resistant to insulin, likely due to inflammatory substances released by adipose, fat, tissue, further complicating glucose regulation. Managing type 2 diabetes often begins with lifestyle modifications such as a balanced diet, weight management, and exercise. In many cases, these changes can restore insulin sensitivity, delay progression, and reduce the need for medication. However, as the disease progresses, medications that enhance insulin sensitivity, reduce glucose production, or stimulate insulin production become necessary. In advanced stages, insulin therapy may be required to maintain blood glucose within a safe range. The dietary plan for someone with diabetes requires careful attention to food types, portions, and timing. One approach often recommended for diabetic patients is the plate method, which emphasizes balanced meals consisting of lean proteins, whole grains, and plenty of non-starchy vegetables. Carbohydrates directly affect blood glucose levels, making it essential for those with diabetes to monitor carbohydrate intake. Complex carbohydrates, such as those found in whole grains, legumes, and vegetables, release glucose more gradually than simple carbs, which helps avoid blood sugar spikes. Foods high in fiber, such as oats and leafy greens, are particularly beneficial because fiber slows down digestion and glucose absorption, providing a steady source of energy. Carbohydrate counting or exchanges, guided by a healthcare professional, can be useful for planning meals and controlling blood sugar. Protein is an essential macronutrient for people with diabetes, as it has a minimal impact on blood glucose levels and helps promote satiety, making it easier to avoid overeating. High-quality protein sources such as lean meats, fish, eggs, and legumes are valuable additions to the diet. In particular, fish rich in omega-3 fatty acids, such as salmon and sardines, are highly recommended due to their anti-inflammatory effects, which can support cardiovascular health, a key consideration for people with diabetes, who are at increased risk for heart disease. In addition to proteins, healthy fats are a critical dietary component. Monounsaturated and polyunsaturated fats found in avocados, nuts, seeds, and olive oil can improve insulin sensitivity and provide lasting energy. These fats also help stabilize blood sugar levels by slowing the absorption of glucose. However, it's essential for individuals with diabetes to limit saturated fats, as these can contribute to insulin resistance and increase the risk of heart disease. Replacing saturated fats with unsaturated ones supports better metabolic health. Beyond traditional methods like fasting blood glucose and A1C testing, new diagnostic and monitoring tools are continuously being developed to improve the accuracy and ease of diabetes management. CGM systems represent a groundbreaking advancement in diabetes management. These devices use sensors inserted just below the skin to measure glucose levels in real time, transmitting data to a display device, allowing for continuous, dynamic monitoring. CGMs have been shown to improve glycemic control, reduce hypoglycemic events, and provide insight into blood sugar trends in response to food, exercise, and stress. CGMs are especially beneficial for individuals with type 1 diabetes, as they enable prompt response to blood sugar fluctuations. For people with diabetes, glycated albumin and fructosamine tests offer alternatives to the A1C test, especially in situations where A1C results might be inaccurate. Glycated albumin and fructosamine measure shorter-term blood glucose control, 2 to 3 weeks, which is useful for assessing recent dietary or medication changes. These tests are particularly helpful for patients with anemia, as they are not affected by hemoglobin levels like the A1C test. Research has advanced in evaluating beta cell function and insulin sensitivity more accurately. Tests such as the oral glucose tolerance test, OGTT, can assess insulin response after consuming glucose, providing insight into how well the pancreas produces insulin. Additionally, intravenous glucose tolerance tests, IVGTT, and euglycemic hyperinsulinemic clamp tests are sometimes used in research and specialized settings to evaluate insulin sensitivity and beta cell function comprehensively. While not routine, these tests provide valuable data in complex cases or studies aiming to understand the disease mechanism better. Diabetes is a multifaceted condition that requires comprehensive management, encompassing dietary control, regular physical activity, medication adherence, and continuous monitoring. For individuals with diabetes, understanding and adhering to dietary recommendations can make a substantial difference in blood glucose control, health outcomes, and quality of life. Additionally, awareness of predisposition factors allows for early diagnosis, timely interventions, and, in some cases, prevention. With advances in diabetes treatment, including innovations in technology and personalized medicine, the future holds promising developments for improved diabetes management. Educating and empowering individuals with diabetes remains essential to fostering a proactive approach to managing and potentially overcoming this widespread health challenge. Managing diabetes is a complex, dynamic process that encompasses dietary control, lifestyle adjustments, medication, and continuous monitoring. Each type of diabetes presents its challenges and requires specific treatment approaches. Type 1 diabetes, marked by the absence of insulin, requires a vigilant insulin regimen to mimic natural hormonal rhythms. In contrast, type 2 diabetes involves managing insulin resistance through lifestyle and, eventually, pharmacological interventions. Diet plays a pivotal role in managing diabetes, with a focus on balanced macronutrient intake to regulate blood glucose levels and support overall metabolic health. By making informed food choices, individuals with diabetes can avoid extreme blood sugar fluctuations, which helps in preventing complications and optimizing energy levels. Understanding which foods have a high or low glycemic impact empowers individuals to maintain a balanced blood sugar profile and fosters a healthier, more fulfilling lifestyle. Advances in diagnostic technology, such as CGM, enable real-time glucose monitoring and individualized treatment adjustments, promoting better outcomes and making diabetes management more precise. These advancements signify an ongoing shift toward personalized medicine, where treatments and interventions are increasingly tailored to the individual's genetic makeup, lifestyle, and specific disease mechanisms. Ultimately, the future of diabetes management lies in a comprehensive, holistic approach, integrating medical innovation, dietary science, and lifestyle adaptation. With this multifaceted approach, individuals with diabetes can achieve not only control over their blood glucose but also a higher quality of life, reducing the risk of complications and fostering a path to wellness. As research continues, there is hope for new treatments and potential preventive strategies that could alter the course of diabetes, providing relief for millions worldwide and offering a brighter future.